South Africa has been in the grip of a deadly foodborne disease known as listeria. According to the health minister, the country's outbreak has been the largest globally recorded.
The source of the outbreak is likely to be a food product that is widely distributed and consumed by people across all socio-economic groups.
The disease was first detected in January last year, but a seemingly slow response to find its source left more than 170 people dead.
To confirm outcome of illness to date, there's been a 30% death rate.
34-year-old Sunette Clack was 14 weeks pregnant with her third child when doctors allegedly failed to diagnose her with listeriosis.
One day she was there and the next day she was gone. She was just gone.
Now, after the source of South Africa's listeria outbreak has been found, Special Assignment tracks the journey of this deadly bacterial outbreak to see how the health authorities' attempts to contain it and find its source has finally led to a breakthrough.
She was always a happy child, very happy, always smiling. We loved her for that because she was always smiling. And that's what we missed a lot now.
34-year-old Sunette Clack was 14 weeks pregnant when she was admitted to hospital.
She got pregnant in October. They were very happy about that. Also the kids, they were like fighting, is it going to be a boy or a girl? And because she's very fond of kids, you know, she was in seventh heaven about that. And then in November, she started bleeding. And she went to Tshwane Hospital, and there they were looking for the heartbeat. They couldn't get a heartbeat. And they took blood and they said she must come back in 2 days' time. She went there on the 12th and the 14th she went back, but then they told her already that the baby is dead. So they gave her a tablet and they keep her in hospital for the 1 day until the next morning to 3:45. They discharged her.
3 weeks later, Sunette was readmitted to the casualty ward.
She got sick afterwards. I think it was for 2 days. The 30th of November, it was a Thursday and a Friday. She complained about headaches. She was very nauseous. She was in a very bad condition. When they found the ambulance at 11 o'clock on the Friday morning, the 1st of December, it's just gone worse. The headaches and the nausea. They took her to the hospital. They didn't do anything for her. They just left her there. And then she became unconscious. So when her husband got there, he was furious because they didn't put a pillow underneath her head. They didn't close her with a blanket or anything. And by that time, she was not talking at all. She was unconscious. She didn't have any drip on her. They just left her there. The only time when they actually did something for her was at night time, 9 o'clock. They did a CT scan, and then the Saturday morning we only got the results, and they said that she has got fluid on her brain. Her brain is swollen.
Sunette was diagnosed with meningitis. A few days later, doctors declared her brain dead after she suffered a heart attack.
Went to the hospital, although I know she was actually brain dead. I was holding her. I could hear, you know, I could feel the warmness and I could feel her heart. So for me, it felt like she was still alive. Then the Friday, they called us in. And they said to us, they can't do anything for her anymore. We must decide when to put down the machines. So we decided to put it down the Saturday at about 11:30.
Tanya laid a complaint with the Steve Biko Academic Hospital for what she considers to have been the neglectful treatment of her daughter.
This is, yeah, I just feel the way that they treated her was, I don't know how to actually say this. I really think they don't know what they are doing, some of the staff members. I was actually shocked to see how they were treating her. She was at the stage that she really needed somebody to help her, but there was nobody that, she couldn't even talk and tell them, I need this or I need that, or the pain is here or the pain is there, please help me. They just neglected her and just leave her like that.
When Special Assignment contacted the hospital for their response, they denied Mrs. Clack's allegations. The grief and heartache at the sudden loss of Sunette, a mother, a wife and a daughter, has left a void of emptiness.
We're missing her dearly. We will never see her smile again, although she's in our hearts. But this was unforeseen. And the fact that she was actually getting better, that was the worst of all. The one day she was there and the next day she was gone. She was just gone.
Tanya only learned that Sunette had contracted listeriosis when she suffered a heart attack in hospital.
Well, there's been an outbreak of a foodborne disease called listeriosis. According to food safety, listeria is bacteria found in soil, water and vegetation. It can also occur in some animals, including poultry and cattle. The health department announced this morning that more than 30 people have died following the outbreak.
This announcement by the Department of Health came in December 2017. It was almost a year after listeria infections first surfaced, with the death of newborns at 2 separate state hospitals in Gauteng.
Doctors working in pediatrics at Chris Hani Baragwanath Hospital and doctors working at Steve Biko Hospital in the pediatric units both noticed an unusual increase in newborns in their units that were diagnosed with listeriosis. So they contacted the NICD, and we'd had no reports from elsewhere in the country. But what we did was to find out how many cases of confirmed listeriosis there had been during the year to date for 2017, and also looked at the number of cases that South Africa had for the few years before that.
When food that has been contaminated with listeria is eaten, it causes listeriosis, a bacterial infection that can lead to death.
Especially the high-risk groups, your young babies up to the age of 28 days, the elderly above the age of 65, pregnant women, people who are immunocompromised, so HIV patients, cancer patients, diabetics, patients with liver disease and kidney disease. Those groups, we want them to be very, very attentive, be vigilant. Even with flu-like illnesses, they must please consult their clinics or their general practitioners as early as possible so that we can catch it early, diagnose it early and treat it, because it is treatable.
Statistics gathered by the National Institute for Communicable Diseases also showed a high death rate amongst people between the ages of 15 to 49.
Most of the cases, almost 60%, are still in Gauteng province, with Western Cape and KwaZulu-Natal making up another 20% of the cases.
The National Institute for Communicable Diseases said that in the past 3 months, about 900 people had been diagnosed with listeriosis. private hospitals reported a 30% infection rate, with double that rate at public hospitals. By December last year, the Minister of Health had not found the source.
The most likely possible source is either contamination of food at origin, that means at farms and agriculture, or from food processing plants. We believe these are the two main sources where we need to concentrate our search. The source of this outbreak is currently being investigated, and all the stakeholders are cooperating with the investigation, which is led by the National Institute of Communicable Diseases. Environmental health officers are following up diagnosed cases and are visiting their homes to sample food where it's still available.
Although the disease is treatable with antibiotics, infected patients continued to die. The death toll peaked just over 2 weeks ago when 57 people died in 7 days. Since December 2017, more than 170 people have died from listeriosis.
People aren't aware of listeriosis. I think a lot of people, you'd be surprised that even some doctors might not have enough information. We've had to train our own healthcare professionals, make sure that they know what it is, they know how to handle it, how to pick up signs and symptoms, and how to treat it.
The National Institute for Communicable Diseases conceded that they were dealing with a disease which until recently they knew very little about.
The only previous outbreaks that have been described of listeriosis are in 1977. There was a group of 14 people in Johannesburg that developed listeriosis over a very short period of time. But that was in fact before we even knew that listeria was transmitted by contaminated food.
Municipal health inspectors have had the arduous task of inspecting premises, collecting food samples, interviewing patients infected with the bug, and following up with families of the deceased to find out what they ate before becoming ill.
It could be in your body, for as long as 70 days, like in the case of listeria. Other bacteria and viruses show their early, signs and symptoms as early as within a period of 72 hours, which is 3 days or 48 hours, depending on what it is. So the listeria bacteria manifests its symptoms and signs 70 days. So that's part of, I would say the challenge in terms of picking up infected people early enough.
With the most reported cases in the country, Soweto was the epicenter of the listeriosis outbreak. We accompanied the City of Johannesburg's environmental health inspectors when they embarked on an awareness campaign in the township.
Listeriosis was declared by the Minister as a notifiable medical condition in December last year. And so now there's surveillance, ongoing surveillance. We will be able to collect enough data to get to the bottom of what is really going on.
In late December 2017, the Health Department announced they had found the source of the listeria outbreak. They named Sovereign Foods, a poultry abattoir, as the culprit. The facility was shut down, but the department could not isolate the bacterial strain responsible for more than 90% of reported listeriosis cases.
The challenges currently that we're facing is the fact that we aren't finding the particular sequence type 6 in the food isolates. So we're seeing this large clonal complex of sequence type 6 in human cases. But I think the major problem is that we are yet to identify it in a particular food source, and I think that's the most challenging part of it.
Even though the listeria strain found at Sovereign Foods could cause illness in humans, the health department allowed the facility to reopen when it complied with stipulated sanitary conditions. Since the outbreak, listeria was also found at various outlets in Johannesburg.
To date, in the city of Joburg, we have, out of the samples that we've taken from various, outlets, food outlets in the city. Only 8 samples, were taken where listeriosis was picked up in those 8 samples. 6 of them, of the 8, were samples that were obtained from a butchery and a supermarket in Region G. And 2 of those samples that tested positive to listeriosis were from Region D, from an early childhood facility in Region D.
Despite the bug having been detected in a number of outlets, the Environmental Health Department could not shut them down until the National Institute for Communicable Diseases, who was responsible for confirming the results, had cleared its overwhelming backlog of cases.
We did find positive samples. However, these were preliminary tests. We have had to send the samples to the National Institute for Communicable Diseases for confirmation, and we're still awaiting results. Unfortunately, it's taken longer than we expected. The NRCD is inundated with samples from all over, and they're having a backlog currently.
A listeria outbreak has caused the death of more than 170 people in South Africa in the last year. The National Institute for Communicable Diseases was tasked with matching the strain of listeria infecting humans to a particular food product. It was a race against time to find the source of contamination that has claimed so many lives, and that until very recently mystified health professionals and scientists. Inundated with a backlog of cases to confirm, lab technicians countrywide have been stretched to capacity.
We are responsible for performing reconfirmation of the organisms when they arrive. So at the smaller NHLS private and public laboratories, they'll confirm that it is a Listeria monocytogenes organism that's present. Then they'll send the plates or the cultures to us, and then we will reconfirm the identification of the organism to state that it is a Listeria monocytogenes organism. And then what we'll do is we will perform a DNA extraction method where we are basically looking for the DNA component of the organism that will essentially be sequenced.
Dr. Juno Thomas, who heads up the National Institute for Communicable Diseases, describes how they relied on environmental health inspectors in the municipalities to provide food samples for testing.
National Departments of Health embarked on a systematic program to inspect and sample major food production and packaging facilities throughout the country. And it is the environmental health practitioners that visit these premises that collect food and environmental samples for testing. Obviously, this is a very time-consuming process and depends on the municipal health resources.
The Greater Johannesburg metropolitan area is home to hundreds of thousands of food outlets, formal and informal, that serve an estimated population of 8 million. Here, 189 environmental health inspectors have had the impossible task of ensuring food health and safety regulations are adhered to.
The food industry also needs to take ownership of the outbreak. Although it has serious health consequences, the fact is that it is an unsafe food item that is being consumed by people in the first place that is causing illness.
Special Assignment previously investigated the safety of our Brazilian poultry imports following a food scandal in that country. We found that the meat contained high levels of bacteria and decided to test the main ingredient in cold meats, also imported from Brazil, for listeria.
What happens is once the chicken is fully processed, all the cuts are taken out. The carcass of the chicken is then squeezed through a filter, and what comes out at the other end is this kind of pink slime that has been frozen, which is used in the manufacturing of bologna. South Africa does not manufacture MDM. It's mostly imported from Brazil.
We took a sample of mechanically deboned meat and other samples of ready-to-eat polonies and frozen chicken sold at retail outlets across the city to a private laboratory to test for the Listeria bacterium. Although we approached a SANUS-accredited laboratory 3 weeks ago, they have been unable to analyze our samples because all labs across the country have been inundated with the task of Listeria testing.
Listeria was not mandatory, and as you know, even the Department of Health made it a controlled disease only last year. So before that, it was a microorganism of concern, but it wasn't routinely tested. So now we are testing it because we have now found that there is an outbreak going on. Now we need to find out which particular commodity is responsible for this outbreak.
With awareness being the key factor to tackling the disease outbreak, we took to the streets to find out how much people knew about Listeria and its source.
A senhora sabe o que é a doença de Listeria?
Não sei, mas me ensinaram hoje com a doença de Listeria e que devemos lavar as frutas antes de comer, lavar veites antes de cozinhar, carne também, principalmente a galinha. Temos que lavar bem, cozer muito.
Listeria is a disease. If you have Listeria, you feel it like fever, you have fever and diarrhea.
Where does it come from?
It comes from germs. Yes.
And food?
And if you eat food, you must wash your hands first.
I know nothing about Listeria. It's for the first time I heard about this.
Yeah. What are you selling here?
It's selling inhloko, ikhanda lenkomo.
And there's a lot of demand, the people like it?
Yes, the people like me. People bayangithanda abantu.
What do you know about this disease called Listeria?
Funeka ube amanzi abe clean ukuze abantu bengeke bengenwe izifo. Yonke into indawo kuyona ibe clean.
However, not all informal food traders in the city comply with food hygiene laws, like this vendor who has created an ideal breeding ground for bacteria to thrive in. Dr. Juno Thomas says the country's food safety regulations need to be redrafted in line with international standards and practices to prevent serious disease outbreaks like listeriosis, which for a long time government was unable to contain.
There have been in the last decade many new changes in international perspectives on food safety, and many countries worldwide have adapted their food legislations accordingly. So this does provide an opportunity and a very important impetus to change food safety legislation and impact on food safety management and practice by the food industry.
In a press conference held earlier today to inform South Africans that the source of the Listeria outbreak has been detected, the Minister of Health confirmed that the uncertainty is finally over.
The outbreak strain ST6 has been confirmed in at least 16 environmental samples that were collected from this site. We can now conclude scientifically from what I've just told you that the source of the present outbreak is the Enterprise Food Production Facility located in Polokwane.
The discovery of the source of the outbreak offers little comfort to those who have lost their loved ones, and it does not explain why the epicenter of the outbreak was in Gauteng and the source Polokwane.